I have to say, I am so excited to have you here today. I have been looking for a book on fertility for so long. And so I want to say congratulations on the release or the upcoming
Thank you.
release of your new book, The Lucky Egg, which is behind you.
Yes.
Looks amazing.
Yes.
And a lot of our listeners have been asking me, they've been saying, "Hey, can you have someone on the podcast to talk about fertility?" Because a
Hmm.
lot of our listeners are millennials. They're in that stage in life where they're starting to think, oh, what should I do? Should I freeze my eggs? Things like
Yeah.
that. And I'm 38 and I don't have children yet, but I would like children one day. And I'm really
Hmm.
grateful for all of the conversations today. I find that more people are talking about fertility, which is really wonderful to hear. But I find that there are
Hmm.
also a lot of misconceptions out there, which can instill fear in people. And so I'm hoping you can start by sharing what really inspired you to write this book. And yeah, maybe a little bit more background on you.
Yeah, for sure. So I'll start with the background on me because I feel like that is the origin story for the book. All of this happened very organically. I'm a practicing board certified OBGYN, specifically a reproductive endocrinologist and fertility expert. And so the bread and butter of what I do day in, day out is I talk to individuals or couples that are navigating infertility. They've been trying on their own and they're having difficulty. Sometimes it's same sex couples where they lack a key component and they need my help to navigate using donor egg or donor sperm or surrogacy. I have a lot of patients, almost half my practice are women that aren't ready in this exact moment, but they know about the biological clock and they want to figure out a way to strategize for their future. And so they may consider options like egg or embryo freezing, and they may even come to me not with the intention of doing those things, but almost to kind of fill in the knowledge gap. I always
Mhm.
say what I do in my day to day when I see patients is kind of like health class 2.0. And now the book is an extension of that. But in all of those types of scenarios and conversations where I'm meeting people where they're at, I do see a vast knowledge gap where people are on completely different pages and everyone has a different experience or level of knowledge that they're coming in with based on the luck of the draw of who their OBGYN happens to be,
Mhm.
the right information that they came across or the wrong information that they came across online, and who their friend group is and how openly they talk about everything. So people are on different levels in terms of what they know. And I see how knowledge is so powerful because the people that come in knowledgeable with a good foundation, those are the people that are more self assured. They tend to waste less time. They tend to get caught up in less misinformation online that then, can create detours and problems for them. And they're able to kind of go through the process with more ease, whatever the process looks like for them. A huge component of fertility treatment, whether you're doing it to preserve for the future or overcoming a barrier, is a mental game. And anytime you're out of control or you don't know what's going on, you're going to feel more anxious and stressed.
Mhm.
And that can make it harder to stick with it until you're successful. And so it's this vicious cycle. And in all of that, that's what really propelled me into becoming a physician that not only sees patients, but also creates content and tries to educate the masses. And it happened over the course of the last 5 years. If you told me in medical school I would be doing the things that I'm doing now, I'd be like, there's no way.
Mm.
My main purpose is to help patients. But I think I've now realized, and it's all happened, like I said, organically, that the best way to help the people that walk through the door to see me as a patient is to start with basic education on a broader scale. And it's so much more gratifying to be able to help people that will never come see me as patients, right? Because it's a need. And that's really been my driving principle is what already exists. I don't need to reinvent the wheel, but where
Mhm.
is there a need where I need to fill in the knowledge gap and help people because they're floundering and they're often confused? I'm seeing it every day in the conversations I'm having with people. Every time patients come in and they talk about a misconception, sometimes there's like three of them in one day where I'm like, oh, this is a misinformation that's trending on social media. Clearly,
Mhm.
it guides the content that I make. And in a similar vein, all the multitude of conversations that I've had in the collective last 5 years of my career have, even beyond the last 5 years, even before I was doing anything on social, all of that has been infused into my book. My whole book is patient stories obviously anonymized, but I think that we can learn from other people's paths, other people's challenges, and we can make it easier on ourselves by learning from the past, right? And so sharing those stories, and also a huge emphasis on mental health, because I think that that amount of support is lacking. A lot of people are seeing fertility experts, but the focus is on the physical. Do this test, come in for this treatment. But what about those in between moments where you're waiting for results, or you get results and then you have to sit with them? I want people who read this book to feel like they have a companion, a friend in the know coming with them to their appointments, who's there to comfort them in between the appointments and help them to decode what feels like learning a new language. So it really was this organic journey for me. And as a physician, now I can't see myself being a physician without my blog, without my social,
Mm.
without this book, because it's kind of supplementing what I'm doing and helping to support patients in a better way.
hmm Well, I have to tell you that it's really quite a need because I was in a state where I was so worried. And I have a lot of peers who would tell me, don't worry until you know the facts. And so
Yeah.
I went to social media and I was searching online, hey, fertility doctors, and I found
Yeah.
you. And I
Oh,
started
great.
looking through all of your content. And honestly, it eased my fears. And
Good.
you squashed so many misconceptions that I had in my mind. You know, some things go trend, and I don't know why they do, but we'll go into that
Yeah.
later. And yeah, and so I want to thank you for this book because it's something that we need today. And again, as
Yeah.
you said, it's like that companion. I would say 50% of my friends have frozen their eggs and gone through the IVF process. And I've been that helping hand for a lot of them. And
Hmm.
so it's nice that you can share a resource with a lot of people who maybe don't have that companion, which is
Yeah.
huge.
And I think reading it before you run into problems, like it's not like oh, just in case you run into a snag, it's like this is essential reading for anyone with a uterus and ovaries. And also, there's a huge part of it that's for men as well. I think we all need to understand how our bodies work. Don't you think it's insane that as women, we go through the first half of our lives contracepting in health class, figuring out how to avoid teen pregnancy, avoid STIs. That's the focus. And then there's zero formalized education. You're just kind of learning by osmosis. And think it's hard to learn when you're anxious. And you're naturally going to be anxious if someone tells you you have two, ticking alarm clocks in your pelvic cavity and, you got to get on it. It's like, well, you have all these things you want to accomplish. You want to find the right partner and be in the right financial situation. And it just seems like an impossible proposition to most women that, okay, in between trying to achieve and figure out their lives and get on the right path, they also have this ticking clock in the back of their mind. And they don't even have the right information. No one's
Mhm.
handing them the information to say, here's what you need to know. Here are things that you should be talking to your doctor about if this is going on with your period. No one has that information. And so it's leading to a lot of needless delays for something that's really time sensitive.
Yeah, for most of my life, I was just focused on getting my career in line,
Yeah,
having that financial stability, and then all of a sudden, I'm 38, and I'm like, whoa,
right.
I need to start thinking about this.
It's really unfair. It's
Yeah.
unfair that we don't have formalized education. So that's why I think this concept of a health class 2.0 is actually so important. The 180-degree shift that we have to do mentally, where all of a sudden you wake up one day and you're like, oh, I think I should start caring about my fertility because, there's a time pressure and what do I need to know and where do I find the information? And that's where social media has really exploded because people are hungry for information. But when are they getting it? They're getting it at different points. A lot of women that I see in my clinic, they're high-powered New Yorkers who are at the top of their game in their field, and they're like, okay, now I'm going to pivot. And it's like, well, our biology doesn't always wait. And that's really difficult to have conversations with people along the lines of, these are the current challenges. And you can see in these conversations, people saying, you know what, I didn't even think about this. I
hmm
just kind of assumed that science has gotten so far and all these celebrities are having kids in their 50s that we can kind of do whatever we want to do. And so, it's like there's that unhelpful messaging too that can lead people down a path that makes it more difficult later down the line because they weren't equipped with the right information.
Hmm. Hmm. So I'm really grateful that we can, freeze our eggs,
Yes,
go through the IVF process, and I'm so curious if you can share more information on the evolution of egg freezing, IVF, and also IUI, and maybe explain what IVF and IUI are for those who aren't familiar.
for sure. So let's talk quickly about the biological clock, right? We
Okay.
as women are born with all the eggs that we're ever going to have. We don't make new eggs and we can't repair our eggs. But there is good news because that is the one part of our reproductive system that really ages. The actual reproductive tract itself, the uterus, the fallopian tubes, that can still function over time and it's not secreting hormones and it's not aging the same way our ovaries do. So if we can find a workaround for the ovarian aging issue, then the rest can be easy. And the issue is really twofold when it comes to our ovaries and aging. One is how many eggs we have available. You are born with a stockpile about 1 to 2 million eggs. And at any given time point, if you were to have an ultrasound, we're not counting those types of numbers. We're counting a very small, limited subset. Because in the background, something that's always happening in our bodies is recruitment of eggs. So a small number of eggs are able to kind of escape from the pantry, so to speak, and come to the surface. And I don't know how to make your body to be able to do that. I don't have the technology to make you do that on purpose. And you can't influence that. It just kind of happens on its own. And then what's normally happening, if you're not on birth control that prevents this, your brain sends a signal to the ovaries, and at random, one of those recruited eggs, that small subset, gets randomly chosen like a lottery, and that becomes dominant. And then it eventually bursts and releases an egg into one or the other fallopian tube, and that's called ovulation. And that egg has, a fleeting chance of about 2 to 3 day window to get fertilized, and it might not fertilize. It may or may not turn into an embryo, which takes about a week and then make its way to the uterus. And not every embryo is going to be healthy. So every month when you ovulate, if you get a period monthly, you're only ovulating one egg. So
Mm.
why do the numbers matter, right? Because the other ones that come to the surface that didn't make the cut and didn't ovulate, they just kind of get thrown out. They don't get put back into the pantry. They are now a perishable item, so to speak. And the number you bring to the surface is exactly a reflection of what's in the pantry. So it's going to be proportional. That's why I say pantry, because it's like rationing, right? And then you're
Yep.
wasting those eggs. So earlier in life, when you have a lot in your stockpile, you bring a lot to the surface. And later in life, you bring fewer to the surface. The only reason the egg count matters is if push comes to shove and you have fertility issues. One of the best fertility treatments that we have in terms of how effective and efficient it is IVF. And that relies on having an adequate number. The more eggs available, the more I can get to in an egg retrieval. And the more eggs I start with, the better the chance of ending up with a successful embryo that can get you to your pregnancy. So the only reason your numbers matter is if you're going through treatment. If you're going through egg freezing or if you're going through IVF, the first part looks the same. And it's all about how many eggs I can get to because we don't know how to go to the pantry and pull more out. So it's just about efficiency of treatment. What really matters for your actual natural fertility is what is the odds, what are the chances of you ovulating a healthy egg each month? And that is related to age, and there's no test for egg quality. But as we get older, we have a higher propensity to release an abnormal egg that might have missing or extra DNA. These typos accumulate as we age because these filing cabinets, these proteins, break down. And so we have more disorganization in the way our chromosomes come together when they form an embryo with a sperm. And that leads to sometimes, an embryo not implanting at all, or sometimes it implanting for a little bit and then it stops growing. That's the number one cause of miscarriage in the first trimester. So this can happen to anyone. At best, in our 20s, 20 to 25% of the embryos coming from our eggs will have these errors, but the large majority, 75 to 80%, will be healthy. So you think of it as being a good thing to be in your 20s because, okay, it'll just be a matter of time. You ovulate that healthy egg, but you don't expect someone to get pregnant the first time they try ever because human reproduction is inefficient. And at 35, maybe a third of the time an embryo might be abnormal, but two-thirds normal. I like those odds. 37, 38, it's not bad. It's just 50-50, but it was never zero,
Mm.
right? It was always kind of you're starting out at some certain point where some eggs could be abnormal, but that ratio shifts as we get into our 40s. It starts to shift more in favor of it being more likely to ovulate an unhealthy egg in a given month. So it
Okay.
can take many more ovulations and trying month after month to get there. And there can be a higher risk of miscarriage, but it's not like you fall off a fertility cliff at 35. And it's important and essential to understand the biological clock to understand why egg freezing or embryo freezing is a thing, right? We extract the eggs that are available out of the pantry. They're transient. They're only going to be available for some time. And we go in and we try to take them out. And we do that in 2 steps. You take shots to try to mimic that same signal your brain normally sends out at a higher level to get all of them to be selected and to plump them up and grow them and mature them. And then you have an egg retrieval where we retrieve the eggs. The more you have available, the more you're going to be able to freeze and the more shots you're going to have to be able to turn those eggs into embryos if you ever need them. But more importantly, if they're taken from your ovaries at a younger age, a lower proportion of those eggs are going to give rise to embryos with errors. You're going to have a better conversion rate. So think about egg freezing as a head start. If and should you ever run into fertility issues for whatever reason, a doctor like me says, hey, I think IVF is the best step, being able to dip into the supply of healthier eggs that have a higher conversion rate, and there's more of them from one round of effort than you'd be able to get at a later age. It just gives you, a best foot forward type situation where you're really giving yourself a head start. But that's why you can never say it's a guarantee, because no one can guarantee that every egg will turn into an embryo and turn into a baby, because human reproduction is inefficient. And just because you do this high-tech process doesn't magically make that inefficiency go away. Does that make sense?
Absolutely. Yeah. Yeah. I mean, it's not an insurance policy. It's just peace
Yeah.
of mind.
A
Yeah.
head start. It's a
Mhm.
head start,
Head
and it
start.
can
Yeah.
make IVF more successful. So it's important to talk to your doctor about what is their experience with coming back and thawing eggs for their patients, and in their experience, in their hands, in their lab, because every lab can be slightly different. How many eggs do they think you need at that age to feel confident? And it's a numbers game. And on my website, theluckyegg.com, I actually have an egg freezing calculator. But that's based on my experience, and everyone has their own stats, and they should be sharing that with you even before you begin this process, because it's important to really have a clear understanding and go into the process informed. And I think that part of the counseling conversation gets left out of the equation all too often. When it comes to IUI and IVF, to answer your other question,
Yeah.
it's all about trying to overcome the inefficiency of human reproduction. If someone comes to me and they've been trying to get pregnant, they're under 35, it's been at least a year. They're over 35 or older, and it's been 6 months. And there's no rules, but that's kind of the rough guidance, because it takes time and persistence. And if that doesn't happen by a certain time frame, it's time to do something to make it more efficient. And first, we do testing. We make sure your tubes aren't blocked. We make sure the uterus is a normal shape. We make sure there's enough sperm. We check your hormone levels. Let's pretend everything comes back normal, because if there's something abnormal, that might push you in the direction of, okay, both tubes are blocked, we have to bypass them with IVF, right?
Mhm.
But if everything comes back normal, it might just be the inefficiency, right? It might just be, okay, at 35, there's a 15% chance each
Mhm.
month. And when you're in your 20s, a 20% chance each month that one long shot egg is actually going to get past all those different hurdles we talked about. So now it hasn't happened and your tests are normal. There's no target that we need to work around. Well, you have two options. And one option is the more laid back approach. It's almost like gambling. You're trying to improve the odds on both the egg side, the sperm side. I often refer to this as speed dating for your reproductive tract, right? This is, medicated IUI, taking medication, oral medications often to make the signal stronger. So maybe you select 2 or 3 eggs to ovulate. So instead of
Mhm.
one long shot, 2 or 3 long shots in play. I like those odds better than just one, right? And then at the same time, you're taking sperm and you're injecting it at the top of the uterus after concentrating and washing it. So you're just trying to get multiple eggs and multiple sperm to meet. So it's unlike, what normally would happen where you have one egg and maybe the one egg meets the right sperm. You're hoping for many meetings to take place, and that should improve the odds maybe by 5%, 10% max, right?
Mhm.
So this is something that mirrors you trying on your own, but just gives you an extra push in the right direction on the egg side and the sperm side. Introduces the risk of twins because obviously it might work too well. It's like a 3 to 8% chance.
Mhm.
And it's not doing anything that different. So it's a bit slow and steady wins the race. Maybe try this for 3 to 6 months and then reevaluate. The other option, the other bucket of treatment is IVF. This is much more controlled. It's stimulating your ovaries, extracting eggs, taking the eggs outside the body, putting them directly with sperm, cultivating them into embryos, being able to genetically test embryos and freeze them, and then pinpoint which ones are healthy and which ones aren't, and weed out the ones that aren't, and use one embryo at a time, place it at the top of the uterus, right at the exact point in the cycle that an embryo should be implanting hormonally, and then we basically wait and see if it worked or not. And that is more like a 60 to 70% chance of success of pregnancy with each healthy embryo that's transferred. So it tends to get you there faster, but
Hmm.
it's more work. It's more expense. You're taking shots, you're having a procedure. It's more of a to do, but it gives you opportunities that medicated IUI doesn't. You can test the embryos, so you're lowering your risk of miscarriage potentially because you're ruling out the number one cause of why miscarriages happen. You can freeze extra embryos for the future, so it could be like a form of fertility preservation. Important for anyone starting in their mid to late 30s who knows they want to have one more than one child. Really smart to think about it. Something that I did at 34 because I knew I might want to have 2 to 3 kids. And lo and behold, I really needed to rely on what I froze when I was 38 because it was just harder for me at that age. And everyone's different, but it's good to have this kind of contingency plan if it's important to have a large family and you're starting a little bit later. Your uterus doesn't really age. That's an important fact that you can come back at any age and have roughly a similar odds of success because we can, even if you're not able to make your own hormones, some people go into early menopause, things like that. We can give you the hormones needed to support the early pregnancy. And then eventually the placenta takes over between 7 to 10 weeks. And so I've gotten people pregnant in their mid to late 40s with eggs or embryos they froze at a younger age, or even with donor eggs that are frozen. It's
Wow.
pretty amazing what we can accomplish. But it's important to understand that what you see in the headlines doesn't always tell the whole
Hmm.
story, right?
Hmm.
And so people may have gone through multiple rounds. People may have used donor egg and you just don't know. And it's not our business, but it's important because I think that we have to have realistic expectations about what science can and cannot do.
Hmm. Hmm. I was thinking the other day, I was telling a friend, I said, it's too bad. Yeah, I didn't know about egg freezing in my 20s. And then she had a great perspective. She said, "Well, aren't we lucky today that we have this opportunity? Our
Yeah.
mothers and our grandmothers didn't have this opportunity."
Oh,
So,
absolutely.
yeah,
Yeah,
and
and
I
and they had it harder in a lot of ways, right? They had way fewer rights than we did. So I
Mhm.
don't envy them. But I do think they didn't have to deal with the 180 struggle that we're talking about because for better or for worse, I don't think it's a good thing. I'm not a trad wife, okay? I'm not sitting here saying it was great that my mom had an arranged marriage at 17 and had her first child at 21. I mean, she ended up carving out her own path and still becoming a career woman and pursuing her goals. So good on her. But, she was in a situation socially and in her family where she was set up to, be able to start having kids in her 20s, whether she wanted to or not in the moment. That was
Mhm.
just what everyone did. And even outside of that kind of cultural context, our moms or grandmas, like it was just normal to start having children in your 20s. And maybe there's a lot of people that wanted careers and wanted other lives and they were forced into doing something they didn't want to do or that they weren't ready to do. So I don't think it's necessarily a good thing, but I do think now we have all this choice and it's wonderful. But
Mhm.
I think there's a lot of choice with lack of guidance. And that's my whole point is like we need to be giving realistic statistical information. We need to be giving people the information. And it's tricky because not everyone wants to receive the information. Sometimes the information is painful or anxiety provoking, but we have to do a better job of communicating in ways where people are able to mentally receive it, process it, and then make informed decisions for themselves and think truly about what's important in their lives and what they want and what is a realistic path to get there.
Mhm. I actually had some friends who said, "Hey, you should get an AMH test." And I was like, "Oh, okay.
Hmm.
What is that?" And they're like, "Oh, well, it'll help you understand how many eggs that I guess you would pass." And so I got this test done and
Hmm.
I got the facts back and I couldn't hide my age. I thought maybe I could because I'm healthier. I thought maybe, oh, I'm healthy 38 year
Yeah.
old. Maybe I'll be above the median line of
Yes.
where I should be in terms of my egg count. I'm curious if you could share why or how this test it can be helpful and
Hmm.
how the number of eggs we have doesn't necessarily reflect the quality as
Yeah.
well as our chances of pregnancy.
Yes, 100%. So it's what we were talking about earlier. The fact that, and that's why I always start with the biology lesson. Sometimes patients look at me like I have two heads. They're like, really? You're going to start drawing a uterus and fallopian tubes and
Yeah.
talking to me like I'm in biology class? Yes, because every time I have these types of questions, we go back to the fundamentals and the basics. I just explained to you that, yes, a bunch of eggs kind of come to the surface and it's like rationing. So that number, that count on ultrasound and the AMH test, which is a blood test, AMH is actually coming from all the little bubbles of fluid that we're counting. These are
Mhm.
called follicles. It's secreted by all the cells that line each of them. So your AMH level is going to be higher if the egg count we see on the follicle count, on the ultrasound is higher. And what does it mean if there's more follicles at the surface? It means that there's more in your stockpile. So it just gives you a relative sense of your egg reserve. But ultimately, it doesn't impact your fertility because when you're thinking about trying on your own in the future, when you're ready, you're only ovulating one egg. And so whether a bunch come to the surface or a small number come to the surface, as long as you're above the critical threshold, which is at least 1,000 eggs in your stockpile, where your body can still send the signals to the ovary and your ovary can respond and you can release an egg, right? Because if your numbers get so low down, eventually you kind of run to the bottom of the barrel and you can't have any eggs escape anymore. That's called menopause, right? The average age of menopause in this country is 50, 51, but it's different for different people. So that's why I say, if your mom went into early menopause, like closer towards her early 40s or even before, or you have a sister who did, or lots of women in your family, that could be a genetic risk factor for that happening to you. And you want to be really careful about that. So I'm not saying throw caution to the wind, your AMH doesn't matter, but your AMH doesn't always accurately predict age of menopause. It's not going to predict your fertility because when it comes to trying on your own, you're only ovulating one egg per month. So it's not a numbers game. It's more critical what the quality of those eggs are.
Mhm.
But AMH is helpful. I don't want to bury my head in the sand. I do kind of want to know, where do I stand? Because we don't know who will need fertility treatment and who can benefit. And if someone's thinking about doing egg freezing, then your AMH helps me figure out the right dose of medication to give you. And it also helps me give you realistic expectations because the lower our egg count, the lower our response might be, the more the chance of maybe being someone that will consider doing more than one round, because that's the one
Mhm.
thing you can do to accumulate more eggs is to say, okay, I'll just do it again, right? But I'm limited to working with whatever your body makes available. And that's the only reason that this matters, is for the purpose of egg retrieval, which you may or may not do, depending on the person. And it does matter if it gets to a point where the ovaries stop responding to signals and functioning because it's at that low critical point. But a
Mhm.
lot of people with low AMH will go their whole lives and not necessarily get to that critical point much earlier than their peers with higher AMH levels. It really just depends.
Mhm, mhm. You can have a lower AMH and have, no difficulty getting pregnant, which I've heard, so,
Correct. I've had
yeah.
many patients, or even people who follow me online, send me, DMs about, okay, I had an AMH of 0.09 and I was
Mhm,
able to get pregnant in my 30s and it was fine. I have actually often screenshotted those and then I've saved them to my AMH highlight because I think it's one thing for me to say it and say this is a biological fact. It doesn't really predict your ability to get pregnant. I can show people papers that have been done that have looked at this question. It doesn't predict the ability to have a live birth if your AMH is high or low, right?
mhm.
But until people hear other women's stories, I think that it's harder for them to decouple the concept of a low egg count and infertility.
Okay, and it's just a reality that as we age, our egg count is gonna get lower,
Yeah,
right?
we
Yeah.
don't make new eggs and we can't repair our eggs. So our egg count and our egg quality is always changing. And that
Mhm,
doesn't, it's not a reflection, as you said, on your lifestyle not being healthy enough or you not doing enough or taking enough supplements. This is like death and taxes. It's
mhm.
just a reality of our biology. And it's something we should really normalize.
Yeah. I've always had this, which I later learned is a misconception in my mind because I got my period late in life. And so I was like, oh,
Hmm.
well, I must have a longer runway. And,
Yeah.
I'm very healthy. I should be fine. And then
Yes.
and then I get the AMH test. And again, it doesn't mean that my eggs aren't quality. It
Yeah.
just means, oh, you have less a small
Yeah.
lower egg count than the median. And I was like, it didn't worry because I knew the facts. But it
Yes.
also I couldn't hide my age. I
Yeah,
was like,
no, but I
yeah.
think that a lot of people have this misconception, even when they're going through infertility. I've had patients in their 40s come to me and say, I work out all the time. I eat clean. I've never smoked a day in my life. I don't drink. My chronological age is actually, my biological age does not match my chronologic age. And they've even come from functional doctors and other people that have told them this. And I'm like, oh, I don't know what test they did on you, but
Yeah.
all I can tell you is what I know about fertility, and there is no test I can do to confirm what your egg quality is. But they'll go through treatment and kind of be really shocked and in denial about the reality. And as you said, it's everyone, no one is immune to aging, right? And it's just a fact. And I think it's just important for us to be realistic about it. This is why I am so vocal against this idea of reversing egg quality changes with supplements and this, that, and the other. I mean, I have a whole section in my book on
Mhm.
supplements, and I'm not anti-supplement, but I think that we have to be more judicious with what we consume, because supplements are actually so unregulated and there's so many overreaching claims. It was the hardest chapter for me to write because I had to wade through so many terrible studies. And it was just not enjoyable for me to read some of these studies and be like, are you kidding me? Like, they're basing this on 30 mice or like 100 women that it's not even a clean study group. It's not a well-controlled study. And all of these things, you see them permeate and perpetuate so far into all of the Reddit chat rooms and all the things that people are talking about, and they trend. And you're like, I can't believe people are spending thousands of dollars on XYZ, when in reality, me, the expert who actually treats women, I'm not seeing this help. And I'm not seeing any studies that even show any shred of evidence that it would help. And so I'm really all about trying to stop the distraction and the noise and say, let's focus on the things that actually matter, because you don't realize it, but a lot of people are burning themselves out by doing all of these unnecessary interventions and things. They're burning their wallets, they're burning themselves out, physically and emotionally. You don't think about it, but having a counter filled with 20 different supplements that you now take 2 or 3 times a day, I worry about the additive effect that could have on your system, because a lot of people don't realize that supplements can put you into liver failure or give you heart arrhythmias. Like, there is such a thing as overload. And you don't always know what you're doing when you're taking all of these things in combination. But also, it just burns people out to be like, oh my God, I'm doing all of this and I'm spending all this money and I'm not seeing
Mhm.
results. When in reality, that wasn't really the main thing they should have been focusing on.
Mhm, mhm. And another factor is men, right? A lot of us, we don't think
Huge.
about men, and the biggest
Yes,
misconception is that it's all on the women when it's or
absolutely.
and it's not a woman's issue. It's
No. Half of
men.
cases of infertility have a male factor.
Yeah,
And that shouldn't be shocking, right? That should be very obvious. But there is this, men are shielded from this conversation so much. And I shouldn't say it as in it's all advantageous for them. I think they have way less of a community online.
mhm,
Less men talk about fertility. There's less support for them when they are, identified to have a major problem, especially like lack of sperm, things like that. I think women, we've done a great job of coming together and forming communities. And I think men get left out of the conversation all too often. But they often do, because people are thinking, hey, well, they always make new sperm. So they don't have the same problems that we have. And it's easier to fix all the problems because there's this narrative of, well, IVF, you can just inject the sperm directly into the egg
mhm,
and overcome everything. And it's not always so simple. And I think that we do need to pay better attention to not just making sure we're testing men at the same time as the female partner and not wasting time and assuming it's the female partner, because it's a cheap test. It's not that invasive at all. And it can give you a lot of important information. And men can keep making new sperm. And so there's always room for improvement. And this is why the conversation about men's habits is so important, right?
mm,
Because it's important for them to not smoke. It's important for them to minimize alcohol intake and to have a healthy diet and not be sedentary. And, if they're struggling with obesity, that can be a major problem for healthy sperm production. Not only is this important to helping their partner who's going through treatment and often bearing the brunt of a lot of the invasiveness of treatment, taking the shots, if they're going through IVF, having
mhm,
an egg retrieval, so much of that burden falls on the female partner, that it really is important for the male partner to do everything they can to optimize their health, not just for the success of treatment, but also because there's studies that actually relate chronic medical conditions and lifestyle factors to the health of future children. and also the health of the placenta that forms in pregnancy, and therefore potential obstetrical risks and complications that their partner can face. And
Mhm.
that's very real science that's been built up over the past decade. There are many studies that show the relationship between the male contribution and these other outcomes that we previously never really focused on because no one drew any sort of, connection between the two. But there is a real connection because the male health, the male genes and contribution to building the placenta is so integral to the health of a future pregnancy.
Mhm. In your book, you said that, men do have a biological clock in a way. Male
Yes.
infertility contributes to, you said, half of all infertility cases and 30% due to male factors alone. I was like, whoa,
Yep.
how do more people not know that?
I know. I
Yeah,
know. And
it's
it's something that is potentially treatable and something that we can be working on. So both partners need to concentrate on being the healthiest version of themselves and really, showing up with their A game. That's what I always tell my couples that I treat.
Mhm. Mhm. Another misconception is that birth control causes infertility. And in your book, I learned that being on birth control can actually be good for your ovaries or something like that, right?
Yeah.
Could
Yeah.
you
Well, it
share
can
that
help.
more? Yeah.
It can help if there's imbalances, like let's say due to PCOS, right? When people have polycystic ovary syndrome, it is a condition that can manifest in so many different ways. One of the major ones for a lot of people is that they can be insulin resistant. And that resistant to that signal from insulin can actually cause their ovaries to overproduce testosterone because they churn out more insulin,
Mhm.
and insulin actually has that effect on our ovaries, interestingly. And that can create an unhealthy environment where the eggs are being matured, and having an imbalance of too much testosterone not only can be problematic for fertility, but and also make it harder to ovulate on time, but it's also a quality of life issue. People complain often of skin changes, acne, hair loss where they shouldn't have hair loss, hair gain where they shouldn't have hair gain. And birth control in and of itself actually helps by inducing more protein to be made. It's called sex hormone binding globulin, and its name describes exactly what it does. And it goes in and it actually kind of sops up all of the excess free testosterone. It binds it to this protein and makes it less bioactive. And so that's why, being on birth control can help with a lot of the bothersome side effects and symptoms, especially certain types of birth control that contain a type of progesterone, because a lot of birth control has estrogen and progesterone.
Mhm.
Yaz, Ocella, these all contain drospirenone, which is a specific type of progesterone that is anti-testosterone in its effects. And so Yaz or, drospirenone containing birth control pills is often first line when people are having bothersome symptoms of PCOS and they're not trying to get pregnant. So you're not trying to make them ovulate, and you can provide contraception, and
Mhm.
you can also give them a form of contraception that helps kind of reduce the effects of testosterone that can wreak havoc on their body. And in the case of, endometriosis, which is another common gynecologic
Mhm.
issue that can affect people's fertility, the way that endometriosis works is it's, cells that act like the inner lining of the uterus are found in places it shouldn't be, most often the pelvic cavity. And they respond to hormones just like the lining of the uterus does. It can build up and then shed and break down. It can cause inflammation, pain, and really, really, surrounding the time of your period can cause you to even have like nausea, fatigue,
Mhm.
bloating, other symptoms as well. By shutting off the signal that your brain sends to the ovary by being on birth control, you're not allowing for those same highs and lows of estrogen from ovulation. So you stop ovulation, you stop feeding that process. And that's why a lot of women with endometriosis will say, I have atrocious periods, but then if I go on the pill or I have the IUD, I actually feel a lot better. And it's because you're preventing it. I think that if you're not someone who's trying to get pregnant and you have endometriosis or you have these terrible periods, by not feeding that process for many years, you're suppressing the endometriosis, and you're kind of, in a way, I think, protecting your pelvic organs, your pelvic cavity, and you're also preserving your quality of life. So it's all about really thinking about the big picture and, do I need to be ovulating right now? Because sometimes ovulation is driving some of these processes that are not great for our fertility. Even, things like fibroid growth over time a lot of that can be driven by the effects of estrogen and the more ovulations you have in your lifetime. So that's how it can actually be helpful. It's not something that everyone needs to do, but I do think there's way too much misinformation and fear mongering online about the birth control being poison and all of this.
Mm,
It's just having a transient effect on your system. And it's not something that's going to, in a long term way, impact your fertility. There's studies on this. The pill has been around since the
mm,
1950s. And obviously, formulations have gotten better. We've been able to give lower doses of estrogen and make it more tolerable. And there's so many different types. So even when people have bothersome side effects, I'm like, you may want to try a different formulation because there's different generations of pills and
mm.
different forms of progesterone. So if someone has low libido, maybe they shouldn't be on a type of progesterone that opposes testosterone. Maybe they should be on one that actually acts a little bit more like testosterone. So it's really about listening to the patient and what they're struggling with and finding a solution that works for their particular situation.
Is it true that it may take a couple more months or it may take longer for someone coming off the pill to get pregnant? I've heard
It
that.
really
Yeah.
it depends on the person. In my experience, most people go off of the pill, they start getting their period pretty quickly. They've
Okay.
been on the pill for a really long time and then they go off of it. Yeah, sometimes it can take 3 months, maybe up to 6 months to get to your regular pattern, but that's not the norm for most people. The thing that I see more commonly is someone who's been on the pill for a really long time, maybe they started it in their teens. Maybe they don't remember, or more likely, it wasn't a clear explanation that was given to them. Maybe, there's a bias towards talking to teenagers in a way where you're like, I don't want to overwhelm them with too much medical information. But they were told to go on the pill, and it wasn't for necessarily contraception in that moment. It was because they had a really painful period,
Yeah.
or their periods were heavy, or their periods were really irregular and all over the map. And they're like, I can't function at school if I don't know when I'm going to get my period. All of the above. They'll go on the pill, they'll be on the pill for maybe a decade or two, and then they go off of it. And now they're like, okay, my period is irregular. It's not the pill that caused that. I mean, especially past the 3 to 6 month mark, it's like, it's just your true pattern emerging.
Mm,
And yes, when you were 13 to 15, maybe your cycles were really regular, but your body's very different now. And problems like PCOS, which are so prevalent, 10% of the population have PCOS. I'd say about 20 to 30% of my patients have some form of PCOS. It's so common. And a lot of times it's emerging in your 20s and 30s, and maybe with weight gain and things like that, that can affect your metabolism and your level of insulin resistance. All of this can kick it off. And so there is this misconception if you go on TikTok or Instagram of, I was on birth control and it screwed up my body and now I don't ovulate regularly.
mm,
No, it's that you were giving yourself a fake period. You were never actually testing out your ovulation all those years you were on the pill. And that's not necessarily a bad thing. But now that you've taken away that suppression, the signals are starting to fire and we're starting to see what your body can do on its own. And all the while, this entire time, you may not have been aware that there was PCOS or endometriosis. And that's not necessarily a bad thing, but I
mhm.
think there's a negative connotation to this idea of symptoms or, problems being masked. I'm like, well, you kind of were treating something because you weren't wanting to get pregnant right now anyway. So you were kind of balancing your hormones and treating this all along, unbeknownst to you.
Mhm.
So it's just about the narrative and really explaining. And I think people feel very angry to be like, oh, I have this problem and I didn't know why I went on the pill. And I do think we need to be better about explaining every intervention that we recommend to any patient of any age, because they should really have a clear understanding of what might be going on with their body at that snapshot in time. Maybe they won't remember it, but you could be talking to their parents too. And I think, we need to be better about explaining why we're recommending what we're recommending and what we're prescribing. And that's something that I have felt very strongly about as a patient on the receiving end of medical care. I have a chronic lung disease. And so, like, if I
Mm,
go to the pulmonologist and they're telling me we're going to do XYZ testing, I want to know why, because understanding the why helps alleviate so much anxiety and helps answer other questions that might come up later down the line. And because I'm a doctor, I understand how knowing all of that can be helpful. But you'd be surprised the number of people that get a box of drugs and they start injecting themselves and they do this 2-week process, go through the egg retrieval, and they have no idea about the details of what they just did. And I
mm,
think that that's not great. A huge part of the IVF section of my book is like, here are what the drugs are, and here's what an IVF protocol is actually doing. This medication prevents ovulation. This medication does XYZ. I think it's important to know why you're doing what you're doing and the medication that you're taking. You have to be informed.
Yeah. Oh, I've been saying that for years, just in general, any medication. I'm like,
Yeah,
it's also good to know about what the medication is going, like the side
yeah,
effects. What is the medication going to solve, and
absolutely.
then what is going to also happen to my body because I'm taking this
Yeah.
medication. Yeah. So I love how I mean, in your book, you mentioned that the number one predictor of fertility is age, and
Hmm.
you have shared information on PCOS and
Hmm.
endometriosis. How can people get checked for that? Those are two reasons why people could be have infertility issues. So,
Yeah. And I want to level set and say there are a lot of people walking around with endometriosis and who have PCOS that don't need my help.
okay.
So yes, it's a risk factor, but having those problems doesn't automatically mean you're going to have infertility. I've heard and I've had patients come into my office crying because they were diagnosed with some of these problems and told you will need fertility treatment, and or you're never going to have kids. I've had that extreme too, and it's like you can't really say that. There is no fertility test that is like a crystal ball that's going to tell us for sure you're going to have problems or not. Even if you have a clean bill of health and no issues with your period and all your tests come back normal, we
Mm,
don't know until you actually go to try, because it's so dynamic, and it's not just about you. It's about your egg, someone else's sperm. How does it
mhm,
all come together? There's so many different things that have to kind of come together, and it's normal for it to not happen the first time you try. But if it starts to become problematic, yes, there could be underlying gynecologic things going on, and maybe they're contributing. Maybe it's not the whole story, maybe it's one piece of the puzzle.
mhm.
But I do think it's important. It's really tough for me, as a specialist, because people will come in and they're like, I've never had a pelvic scan, never had a pelvic ultrasound, never
Oh,
needed one, never complained to my gynecologist about anything, and it's just not standard of care. Pap smears are standard of care. Doing a physical exam is a standard of care, but doing an ultrasound is not. And every once in a while, I'm like, oh, you have huge fibroids that are taking up the cavity. And, this is sure to be very likely to be a problem. And I want you to go see a surgeon, and we should fix this now before these continue to get bigger. And for them, it's like something that's developed over their lifetime very insidiously in a slow fashion. So they're like, yeah, I mean, I guess I felt like I was always bloated, or I guess I always have had
mm,
heavy periods, but this is just who I am. And so this isn't standard of care guidelines. And one of the things I'm really nervous about in my, not nervous, but I'm just going to be vulnerable for a second and say,
yeah.
I've really put myself out there. And it's not like, it's one thing to say something online, it's another thing to put it in print. And I am a very evidence based doctor, but I think of myself as being evidence informed, because you can't always wait for the perfect study to prove that something's
Mhm,
going to be beneficial, right? You do need to look at the data that exists. And in my lived experience as a physician, I do think we could avoid a lot of problems or feeling blindsided if everyone just got like one pelvic ultrasound in their early 20s, mid 20s, or even early 30s. I think it's unacceptable that a 39-year-old can come to me to talk about, freezing embryos or eggs, or now they're going through infertility after trying for 6 months, it hasn't happened. And I'm
mhm.
the first person to ever do a pelvic ultrasound on them and tell them, you have fibroids, or hey, you have
Wow.
endometriomas, you have cysts in your ovaries, or you have signs of polycystic ovary syndrome. It's just to go, a lot of your adult life and to not know that information about your body is not great. And I do think it's a lot to take in when you're already there for a specific reason. Now you have this detour of like, now I'm diagnosed with all of these other things that I had. Oftentimes, sometimes I'm like, you have PCOS and endometriosis, right?
Mm,
And people are like, oh my God, this is so overwhelming. I just came to talk to you about freezing eggs. But if I see something, I say something. I always say, like,
yeah.
I'm not going to just, focus on why you came to see me. I'm going to tell you, hey, I've also discovered these other things. And they may not be a problem for you, but hey, if you get off of the pill and your cycles are regular, like this is probably what it's going to be. Or if your periods are painful, this is what it might be. And you should have a lower threshold to come to me once you are trying, because you do have these other issues that could contribute. Now, ultrasound's not always going to diagnose it. And that's the hard part. Endometriosis doesn't always show up on ultrasound, but
Mm,
sometimes it does. And it depends on where it's located. If it's in the ovaries, in the muscle wall of the uterus, those are fairly obvious things that you can see on an ultrasound. So you could pick it up. And fibroids, you're always going to see it on an ultrasound in the muscle wall of the uterus. PCOS, the ovaries might look a certain way, but unless you're actually allowing yourself to ovulate and see what your pattern is, you may not know. So it's not always possible to pick it up, but I do think that that would solve a lot of problems if people were more readily given the opportunity to have imaging, because that could reveal a lot of cases. And then I think we have to do better at educating people on tracking their cycle when they're not on the pill, and paying
Mhm.
attention to, their period is a vital sign. How heavy are your periods? How regular are they? Are they irregular? How irregular are they? Are they painful? And finding an OBGYN that listens to you and that you can talk to about these, because it's always better to not be blindsided and to make decisions really with full knowledge of what could be going on with your body.
Mhm. Oh, I love the idea of a pelvic ultrasound being a part of the process, like
Yeah.
checkup. Yeah, I hope that is implemented one day. I've
Yeah.
had a pelvic ultrasound before in the past, just like for other
Yeah.
reasons, and so for me, it wasn't the first time I've had one because that was a part of my AMH test.
Yeah. Yeah.
But yeah, I'm also Canadian healthcare.
Yeah.
For
I
us,
know. It's tough.
we're very lucky here in Canada to have healthcare, and I just announced a few weeks ago, actually, is IVF. One cycle of IVF is now covered for
It's
those up
amazing.
until the age of 43. And I was like,
Yes.
wow, that is a step in the right direction.
Yeah.
Obviously, there's no coverage for egg freezing within Ontario so far, Ontario, Canada.
Mm.
But I thought that was really great. And I know that you have gone through the IVF process yourself. And I appreciate you being very open and vulnerable to share that with,
Hmm.
your
Hmm.
patients and in your book. And I think you were 34 and I'm 38, and I'm thinking, wow, if that's an option for me, I'm definitely going to jump on that one day, because if I
Yeah.
want to have a second kid in, my
Yeah.
late early mid 40s,
Yeah.
then that's something that,
Having those embryos frozen can be really beneficial, or having
yeah.
eggs frozen to turn them into embryos if and when you need them can be really beneficial for sure.
Yeah, exactly. And so for some of my listeners who are in, because our listenership spans, but for those in their 20s, and then those in their 30s, and then those 35 through early 40s,
Hmm.
what guidance would you give them today? I know that's a big, broad question, but what should they be
Yeah.
thinking about?
No, I think it's a great question and a good way to think about it. I mean, I think, if you're in your 20s, I think across the board, you always want to think about what could you be doing. Of course, age is such a factor, and the wear and tear of aging on our reproductive system and our eggs specifically is just a fact of life. There are things you can be avoiding, though, that we know speed up the process of decline in our egg count and quality. Smoking, and so vaping. I see a lot of 20-something-year-olds who vape and they think it's safer than smoking, but it's still bad for you. And so that's like, something we know. We have the data. It's associated with earlier age of menopause. It's associated with having a harder time getting pregnant. So if you needed a reason to quit, your reproductive health is one of them, right? Alcohol intake, based on the data, like trying to minimize, to less than 4 drinks in a given week, which I think is a really reasonable amount to say, let's stay below that threshold. But anyone, especially who like goes out for drinks as part of work, they're entertaining clients, it's very easy to exceed that amount. But there's so much information that's come out over the years, not just about the impact on fertility, but the impact of alcohol on cancer risk and things like that, that I think we need to be more mindful. It's been normalized for too long, drinking heavily. And, I think the best diet for fertility is always the best diet for your heart health. Think about it like that. Anything better for heart health is better for your fertility. So that comes down to, Mediterranean style diet, high in
Mm.
antioxidants, healthy fats like avocado, eating nuts, seeds, fruits and vegetables, eating the rainbow, trying to minimize processed foods, trying to minimize red meat and have healthy lean protein. And then when you think about, being sedentary, that's never good for fertility. It's not good for your heart health either. So exercise, we usually say like 150 minutes per week is the goal. That could be like a 30-minute brisk walk every day, Monday to Friday, right? But all of these things seem simple. Sleep, 7 to 8 hours a night is the goal. Again, even if you look back to my analogy about cardiovascular risk factors, there's a lot of data linking sleep apnea, sleep disturbance, insomnia with, cardiovascular events earlier in life. And so I really think that that's the rule of thumb. Anything better for heart health is going to be better for fertility. Think about it in a longitudinal fashion. Don't just think about it if and when you're ready to start freezing eggs or go through trying to conceive. Think about it holistically for your future self, even in your 20s. In your 30s, start to carve out time to prioritize your reproductive goals, because I know what it's like as a busy career woman.
Hmm.
You can just be on the hamster wheel and totally lose track of time. And that I've seen happen to many people. And it honestly would have happened to me. I'm convinced, even as a physician, if I was in a different field, it would have happened to me. I would have never made the time to be like, oh, I'm going to freeze. I would have said, no, sorry, I'm operating, like I don't have time. I just wouldn't have done it. I don't think I would have done it. It was because I worked in the fertility clinic and I made it a massive priority because of my job and what I was seeing every day. And I'm so glad I did, because I ended up needing to rely on what I froze. And it
Hmm.
really took a lot of the pressure off, and it made what ended up being an easy process in the end. It wasn't easy for me to get those embryos, which I talk about in my book. I
Yeah.
did do multiple rounds, and now, I have a whole new level of understanding of what it looks like to go through the shots and not get something useful from that cycle. But
Hmm.
then also needing to do this over and over, and persistence paying off. But it made the tail end then for me, thankfully, easier than otherwise what it could have been. So I do think, not everyone in their 30s has to freeze, but you never want to be someone that says, you know what, I never even knew about it. I never even
Hmm.
thought about it. I wish someone had told me. We've all heard that Jennifer Aniston interview, which is so heartbreaking, where she's like, I kind of wish someone had told me. She was
Hmm.
busy at the height of her career, like such a huge star with all of the resources in the world. But it's so easy to get caught up in life. And I think you have to sit down and carve out intentional time, whether you like journaling, meditating, and thinking about other things outside of your career. It doesn't matter if you're in the perfect relationship or not, or, just focus on like my fertility. What do I want out of life? Do I know what I want? You don't have to know the answer, but figure out what you want. Think about it until you figure it out. Keep thinking about it. And then put it at the top of your mind as like a priority,
Hmm.
because then you might act differently. I think when people think about manifesting, they think about it in too much of a magical sense. It's actually quite logical that if you put something out there in the universe, it means you're thinking about it, you're speaking about it, you're writing it down. Maybe it's on a vision board, but it's now at the forefront of your consciousness. So maybe instead of saying, yeah, I'm going to take on that extra project and I'm going to work through the weekend, maybe you're going to say, you know what? I don't want to, but I'm going to go out and socialize because like I have personal goals and I need to put myself out there.
Hmm.
And, like I think that it can shift so many things in subtle ways to just state what your goals are, because it's going to change your behavior, even in subtle ways that might lead you closer to the path that you're trying to get on.
Hmm. Yeah. I mean, we're so intentional about all these areas in our lives. Why can't we add this in? And we should add
I
this
think it's
in.
hard to be
Yeah.
intentional for people because they feel like it's not all in their control. It
Mm.
feels overwhelming to be like, I'm going to have a baby by age 35. Well, okay, well, that's putting a lot of pressure on me. Like, I don't know if I'm going to find the right person. You know what I mean? But
Hmm.
I'm here to say it's okay to make those types of statements, because all of your behaviors, even in other arenas of your life, will start to gravitate towards that goal. And it's okay to want that.
Hmm.
By the way, there's also like, as a millennial myself, there's like a stigma, that I hope is lifting. But
Yeah.
even in my early 30s, like I had a bunch of kick-ass female friends that were all like, "Ugh, so and so is already settling down and having kids." Like it almost was viewed as like a form of kind of giving up and giving in way too early, because we all want to accomplish all these things. And so I do hope that that's changing, because I think that that's not a helpful way to think. I actually started out in my journey being like, I'm not having kids until my 40s. Like
Hmm.
I have I told my husband that when we were dating. I was
Oh.
like, I hope that's okay with you. Like I just was completely had a different mindset, and only being a fertility doctor, that only because of that, I think I really shifted my thinking. So I see patients all the time where I'm like, I understand that mindset because I was in that mindset.
Hmm.
I actually moved up my timeline, went off of the pill and started trying earlier than when I was emotionally ready to, or even from a career standpoint. I didn't feel fully settled. I wasn't even done with training, but I was married. So I was like, what am I doing here? Like, I'm
Mhm.
assuming I can control all these things. Like, I just came home one day and told my husband, I was like, I'm getting off the pill and we're going to start trying
Okay.
earlier. And he's like, okay, that's not what we
Yeah.
discussed, but
Yeah.
I'm okay with it. And I was like, okay. And then I decided to freeze embryos as well. And it just really kind of scared me straight. And I don't think everyone should be feeling scared,
Mhm.
but it's just, if I could have those misconceptions, even being interested in this field from an early stage in my career and
Yeah.
training, I mean, I can't even imagine what the average person who's not even in medicine thinks.
Mhm, mhm. Yeah, and I think you mentioned in your book that you had your first daughter at 33. So, yeah, you tried much earlier than you said because you said, "Oh, I'm
Yeah.
gonna wait till I'm in my 40s."
Yeah. And
And
some of my friends were kind of like, oh, that's interesting because they
Mhm,
never thought that I would be the type. I had so many things I wanted to do. And I think I just realized like there's never going to be a perfect time. And they don't have to be mutually exclusive. Sure, there's things that you have to consider and you have to make some sacrifices and you can't maybe do everything 100% all the time, whether it's parenting or career.
mhm,
But I'm so glad that I did that instead of trying to wait for the perfect moment, because I
mhm.
think the truth out there in the universe is that the perfect moment never exists.
Yeah. My mom's always like, "Oh, there's never a perfect time."
Yeah. But that saying's so
Yeah,
true. It sounds
yeah.
cliche, but it's so true.
So
And I
true.
think people have a hard time stating what their goals are because they're like, there's too many factors that have to kind of come together for this perfect moment, but the perfect moment doesn't exist.
Mhm. And I should share that, for our listeners that there are a lot of employee benefits now for
Yes,
fertility. And
absolutely.
in the US, I found a study that said that 42% of employees offer full fertility benefits. That was by
Yeah,
the
it's
International. Yeah.
incredibly it's grown incredibly. Like our center where I work at RMA of New York,
Mhm.
and 0% of cycles were covered 10 years ago. Now it's almost 50%. I'm talking egg freezing specifically. And
Yeah.
most of that expansion is coming from the private sector, because especially in competitive markets, you're going to have an easier time convincing your employer or your HR to include fertility benefits because now it's kind of this enticing, added benefit that people are asking about. And I think we can drive change by being less sheepish about it and asking about it at job
Yeah.
interviews to show that it's a priority.
Yeah. Oh, I love that. Yeah, we should ask those questions. And yes, I read that quote in your book about how a decade ago, zero egg freezing cycles were in your or were
Yeah.
covered in your clinic, and now 50% of them. That's so good to hear because
Yeah.
I hope, and I always say this to my friends, I hope that 5-10 years, most companies cover that,
Yeah.
or state mandates change. So.
Insurance
Mhm.
needs to be universally covering infertility treatment. And I think when that happens, when they finally come to and say, fertility is a medical problem, this isn't a luxury, this isn't like getting, plastic surgery for cosmetic reasons,
Mhm.
real major life problem. And people going through infertility suffer the same levels of anxiety and depression that people are who are facing a cancer diagnosis or major chronic illnesses are going through. This is a massive issue. And we need to, I know this sounds like so, you know, eh, kind of just zooming out way too much, but it's not grandiose, I think, to say, we keep talking about the lower birth rate and how are we going
Mhm.
to support the older generation, which is like so much more expanded and plentiful than what we're replacing, and we're not having kids as much. And if we really care about that as a society, we should be thinking about providing better fertility coverage, better education so people make decisions that facilitate having children if that's something that's important to them. And I think once we have universal insurance coverage for infertility treatment, then insurance companies should be smart and do the math and say, well, if we cover egg freezing, then people are less likely to need multiple rounds of IVF to be successful.
Mhm.
So now let's cover that. But it's a progression and we are making progress, but there's still a lot of work to be done.
Mhm. Oh, I could talk to you forever. You are so informed. Like you've shared so much information today that is going to be so helpful for my listenership, and obviously very helpful for me as well. And after reading your book, I just had peace of mind. So
Oh,
thank
that makes
you.
me feel so good. So you read the whole thing. That makes me
Yes.
so
And
happy.
and I'm going to buy the physical copy when it comes out because I want to refer to little notes. There's so many facts in there and so many little notes that I want to
Yeah.
highlight. I always highlight lines and I
Yes.
bookmark certain parts. And it's one of those
Yeah.
books where I'll have a friend over and I can open it up and say, hey, here are the facts, or here's a story that
Yeah.
will help you feel better.
I
So
really love that feedback because that was the whole purpose. Like the whole purpose behind why I got online and started making content was I wanted to make people feel better and less confused. And that's
yeah.
the goal started in my office. Like when people walk in, often they look so afraid and confused and like, what are you going to tell me? And they walk out completely aware of what's going on and much calmer. And that's always been my goal. And so for you to say that, I mean, that means the goal was accomplished because it's a lot of information. And I do think there really aren't very many resources written by actual fertility doctors. That's the first problem. Like the most
Yeah.
popular books on fertility are not written by a doctor, which is insane to me. It's written by, maybe a nutritionist or maybe a therapist, which they have important contributions. But the most famous one, which I will not name by name, is, and it's dominated for decades, is written by just someone who went through three rounds of IVF. And it's like, that does not make an expert, and not only do we not have a comprehensive resource written by an expert until 2026, because the book's coming out in January,
Hmm.
and that's why I did this. But this is also a resource that is up to date for today's world. There's a whole section on LGBTQ plus family
Yep.
building that doesn't exist, and there's a lot more information about egg freezing and embryo freezing that is much more nuanced. And so I think between all of that, it was a lot. I bit off way more than I could chew, but
Mhm.
somehow it's been consolidated into this resource. And every sentence had to be used wisely. And so it is really packed with so much information. And I hope it'll be a rich resource for everyone that's listening.
Oh, it's a very rich, yeah, resource. Like I was thinking, wow, it must have taken her a long time to write this because this is a lot of information. This is amazing.
You know what?
Yeah.
I devoted like a good 6 to 9 months and I poured everything I had into it. I did nothing except work and see patients and come home and write. And that was it.
Wow.
That was my life for like 9 months because I just had to get it all on paper. And I just, for my life, like knew that I couldn't do that for a year or 2 years. It just all had, and it's time, it can't come out soon enough. The publication process is so lengthy, but I cannot wait for this to actually be helping people and
Hmm.
out there.
Hmm. Now, to close this conversation, I was going to ask you this question, but you kind of already answered it. How do you hope your readers feel after reading The Lucky Egg? Because I know you said in
Yeah.
your book and you've said on various podcasts that you've been on that this is a resource that you've always wanted.
Yeah.
Mhm.
Yeah. This is the resource that I'm putting myself in a patient's shoes. Like, what would I need? Or the 25-year-old that's like, I'm on the pill. I don't know why I'm on the pill. Should I be freezing my eggs? My work offers a benefit. Like, I just don't know what I should be doing. I
Mhm.
want them to read it. I want the person who's going through fertility treatment and feels like maybe lost. Maybe they're in a clinic where they're not getting all the answers that they need. Maybe, for the person who is online and they're like, oh my God, it feels overwhelming. There's all these other specialized tests and buzzwords that people are using in these forums. And I feel like a complete newbie and I have no idea what's going on. I want them to feel like, actually, I do know everything that I need to know. And this is all just noise. Don't worry about it. For the
Mhm.
person that's on their fourth round of failed IVF or who's had 5 miscarriages, I want them to have a clear understanding of like, these are all the things they should be thinking about. Here are where the roadblocks can show up and the specific things that I do in my practice because I work at one of the best centers in the world, really.
Yeah.
And we have really high success rates. And so I want to be able to share that expertise and the things that I've learned from my actual life experience treating patients and helping them get past really difficult problems. And then also, I want them to feel mentally supported. And every type of problem has its own mental health struggles. The
Mhm.
person going through diminished ovarian reserve and having a lower than expected result from an egg retrieval has a completely different mental struggle and things that they're grappling with than the person that's been told, hey, you have fibroids. And even though you had the surgery, this is really difficult, but I think, need to use a surrogate.
Mhm.
That is a different level of grief. That is a different type of reckoning that someone has to do mentally. And I wanted to provide a really 360 mental health support. So every chapter has mental health woven through it. And then there's a really comprehensive, the last part of the book is a mental health toolkit with
Mhm.
practical tools on these are the things that I've seen be successful for patients and get them through their treatment because it is such a marathon. It's not a sprint, and you really have to protect yourself mentally and emotionally.
Mhm, mhm. Oh my goodness, that's a whole other part of it, right? There's the
Yeah.
facts that you have to deal with, and then, there's the emotional part, and so having this book is really, really helpful, and then obviously having friends and family close by as well.
Yeah,
So
definitely. And there's also a lot of good tips on how to help harness the power of your social circle because a lot of times we don't know what the right thing to do is. And it's like I've given scripts of like, this is what you can say to loved ones, right?
yeah.
And I think that this is a resource that your loved ones can pick up and read so that the onus isn't on you to educate them and be
Right.
like, okay, this is what I'm going through. It's like, well, no, you can just read and you can
Mhm.
learn and figure out how to best support me.
Absolutely, absolutely. So where can our listeners find your book?
So it's everywhere that books are sold. It's like on Barnes and Noble, Amazon, you can order it online. When is this episode coming out?
On January 12th.
Oh my gosh. Okay.
Mhm.
So you're going to have it
Yes.
in your hands if you order it tomorrow, which is so
Yes.
exciting. You can Amazon Prime it, but basically you can buy it. It's in hardcover. It will come out eventually in soft cover, and it is also available wherever audiobooks are bought and listened to. So if you're someone that likes to listen on your commute, there's also an audiobook version that's narrated by me. And you can find me online. I have a blog, The Lucky Egg, which essentially shares a lot of deep dive on different aspects of things that I post about online. But there's also calculators and tools that will supplement a lot of the information that you see in this book, like an egg freezing calculator, an AMH, not really a calculator, but it plots you in terms of what the data shows is average for age. And so you can kind of see where you fall relatively.
Mhm.
And I'm still working on more calculators and
That's
tools, and there'll
great.
probably be an app in the new year or two. So
Oh.
lots of fun, exciting things. And you can subscribe to my newsletter and you can definitely follow me on Instagram and on TikTok.
Yeah, definitely. Yeah, I highly recommend following her on social media, and I will include all of those links in the show notes. And thank you so
Amazing.
much for all your work. I really appreciate it.
Thank you. Thank you for reading. You're like one of the earliest readers. It's so exciting.
Yeah.
I feel like I had a baby and I'm now like, it's the big reveal to the
Yeah.
world. So
Yeah.
I'm glad you got to read it and you found it helpful. And I just
Mhm.
loved having this conversation with you. And I appreciate you using your platform to share more about fertility. I hope this was helpful for everyone that's listening.
Yeah, absolutely. Thank you so much. And I'm excited to have my physical copy soon.
Yes. Thank you for your support.
Thanks. Bye-bye.